Today is December 12, 2022. I'm going to do a physical assessment on Mr. Toussaint. I want you to face the camera and give me permission to do the assessment.
My name is Toussaint Juliet. I give you the permission to do the assessment.
Okay, first I'm going to check your level of consciousness. What's your name? Your date of birth?
My name is Toussaint Juliet. My birthday is July 17, 1977.
Okay, do you know where you are?
Home.
Who's the president now?
Biden.
And then who was the president before?
Trump.
Okay, he's awake, alert, oriented, time 3. And now I'm going to check his visual acuity. By checking his visual acuity, I'm going to check his near and far vision. Are you able to read?
Yeah, I'm going to assess his mental status.
The other one?
I'm going to assess his mental status.
With both of your eyes?
I'm going to assess his mental status.
Now I want you to cover one of your eyes, do the far vision acuity.
When you love what you have everything. When you love what you have everything.
With both eyes?
When you love what you have,
so
you have
your
everything.
Visual acuity is intact. This is your cranial nerve 2. And now I'm going to do your visual field by confrontation test. Can you cover one of your eyes and let me know when you see my finger?
Now.
Okay.
Now.
How many?
2.
Okay, cover the other eyes. When you see my finger?
Now. Now. Now.
Okay, your peripheral visual field is intact. He's able to see by confrontation test. Now I'm gonna inspect the conjunctiva and the sclera for color and moisture. I can see your conjunctiva is slightly pink, and then your sclera is black. So now I'm gonna do the visual field. Now I'm going to pupillary light reflex direct, consensual, and accommodation. So I'm gonna bring the light to your eyes, and then your pupil is constricted, and then I'm gonna do consensual, that your right pupil, I can see your right pupil is constricted. Now I'm gonna go for the other eyes. I can see your right pupil is constricted. Now this is direct light. Now I'm gonna do your consensual, so I can see your right pupil is constricted, and at the same time your left pupil is constricted. Now I'm gonna go, that's the direct and consensual. Now I'm gonna do by accommodation. I want you to look at the pin light, and then I want you to look straight at it, and as I'm coming closer, I can see his pupil constricted. This is for the accommodation. And now I'm gonna do the extraocular movement. I'm gonna hold the pen light, and I want you to follow with your eyes. Okay, that's good. His extraocular movement is intact. Now I'm gonna the corneal light reflex. By extending the corneal light reflex, this is his cranial nerve 3, 4, and 5, and I'm gonna stand 2 feet away, and I'm gonna shine the light at his eyes, and then I can see both of his pupils constricted at the same time, symmetrical. And now I'm gonna start with the inspection of the ears, so I can see both of your ears is symmetrical, both sides, the external ear. When I palpate, there's no mass. So I'm gonna check your inner ear by pulling the pin up and back, so I can see you have some cerumen in your ears that seem to be clean. And then I'm gonna do the other one again, pull the pin up and back, so I can see the inside, and then it looks like there's no drainage coming out of it. So now I'm gonna do your palpate for your sinuses, your frontal sinuses, and your axillary sinuses. Do you feel any pain doing that? Okay, he said he doesn't have no pain when I palpate the sinuses. Now I'm gonna do the whisper voice test, because I don't have the turning fork to do the Weber and the Rhineland test. I'm gonna whisper 2 words, and then I want you to let me know if you can hear them. Blue, black.
You say blue, black.
Okay, I'm gonna go to the other ear. I'm gonna do the same. Purple and white.
Purple and white.
Okay, his vision is iris is intact, so he's able to respond to the voice when I speak. So now I'm gonna inspect his nasal mucosa. So his nasal mucosa, and then when I do the whisper voice test, that was his cranial nerve 8 that was intact. So now I'm gonna inspect his mucosa. So I'm gonna see your nose is midline, There's no deviation. Now I'm gonna inspect the inside the, so I can see the mucosa is pink, and then there's no septum deviation on his on his nose. And then I'm gonna check for patency. I want you to close one of your nose and let me know if you're able to breathe. And then do the other one. Okay, his nose is patent. He's patent. He's able to breathe. And then now I'm gonna check his mouth by inspection. And which is, I already palpate the sinuses. I always say I palpate both of the frontal and axillary sinuses. So he's denied pain. So I'm gonna put my gloves on to check his mouth, inside of his mouth. Okay, I can say his lip is within normal limit, match his color of his skin. There's no crackle on his lips. So now I'm gonna open his mouth. So I'm checking the teeth. I'm checking the gum. The gum are pink and moisture. Say upper lips is both of the lips, upper and lower. And now I want you to open your mouth and then your tongue. You can stick your tongue out. It's pink, it's moist, and put your tongue up. And then you can see the blood vessel. And now I want you to stick your tongue out, say ha 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 ha. You can see the uvula is midline when he said that. Now I'm gonna check his gag reflex by put the okay. So he has a good gag reflex, which is his cranial nerve 9 and 10. So I can say the uvula is midline, and then he's has good gag reflex, and he has good range of motion of his tongue. He was able to move his tongue in all the direction on his mouth, and there's no white patches noted. And for the, I'm gonna check his olfactory. That's cranial nerve 1. I want him to smell and to let me know if what is this one.
Cinnamon.
Okay, what is this one?
Coffee.
Okay, good. So I can say his nose is very patent again because he's able to make the difference between the coffee and the cinnamon. Now I'm going to his head. So first I'm gonna start with inspection. As you can see, he's very normal cephalic, so there's no deviation of his of the skull. And I'm gonna palpate his palpate for any mass. There's no mass. So while I'm doing his head, I'm gonna check for the lymph node. I'm gonna palpate for the subclavicular lymph node, and then I'm gonna palpate for the submental lymph node, and then I'm gonna palpate for the submandibular lymph node, and I'm gonna go for the preauricular lymph node and postauricular lymph node and cervical lymph node and occipital lymph node, and then at palpable I can say that his trachea is midline and there's no tracheation deviation. And then now I'm gonna palpate for the carotid pulse one at a time, and I'm gonna listen if he has any bruit. And I'm gonna check for range of motion of his neck. I want you to expand your neck. He's able to do hyperextension, and then put your head back down, and then nod. You nod. Nod is like okay. I want you to turn your head back and forth. So he has full range of motion of his neck. Now I'm gonna check for muscle strength. So I'm gonna push your head. Don't let me push it. And I'm gonna do for the other one. Don't let me push it. So this time I'm checking his cranial nerve 11 too, because I'm gonna try to push your shoulder down. Don't let me do it. That's his cranial nerve 11. So now I want you to take your shirt off. I'm gonna inspect your thorax, your frontal and posterior thorax. As you can see, he's breathing normally. His frontal is interior thorax. There's no scar noted on his chest. So I'm gonna go for the back. This is the back. Yeah. So when you check on the back, so he doesn't have his you can check for his spine is straight, so there is no curvature, no scoliosis. So now I'm gonna do the I'm gonna do the tactile frequencies. I want you. I'm gonna say 99, and
99.
Okay, I can hear the vibration.
99.
I can feel the vibration.
99.
Okay.
99.
And then
99. 99.
good.
99.
Good.
99.
Good.
99.
Good.
99.
Every time he said 99, I can feel the vibration. Now I'm gonna do the percussion. I'm gonna start from the back posterior chest. Okay. I'm gonna do the anterior chest. And then I'm gonna check for his chest expansion. So I'm gonna put my hand, and then I'm gonna ask him to take a deep breath, and you're gonna see when his chest is expanding. Take a deep breath. Yeah. One more. So when he's take a deep breath, his chest is expanding. And I'm gonna do for the same, the posterior. And I'm gonna put my hand again. Take a deep breath. Yeah, good. One more. Good. You can see his chest is expanding when he take a deep breath. Now I'm gonna listen to his lung sound for any abnormal lung sound. I'm gonna start from the interior. Take a deep breath. Good. One more. Good. 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 Now I'm gonna listen for the posterior. Good. Okay. So his lung sound is clear. He doesn't have any abnormal lung sound. So now I'm gonna listen for his heart. So I'm gonna listen for S2 and S1. S2 is the second intercostal space. This is the clavicular. This is the first intercostal space, second intercostal space. I'm gonna listen for the pulmonic. And then I'm gonna look for the apex of the eye. And then this is gonna be mid-clavicular between the fourth and fifth intercostal space. This is clavicular 1, 2, 3, 4, and 5. So the apex of the heart is right here. I'm gonna listen for the lobe dub. Good. He has a good heart sound. It's regular. So now his lung sound is clear. Now his heart is visual. Now I'm gonna check for his visual jugular vein. If I like the jugular vein to see if it mostly if you cannot see it because mostly it's patients who have a lot of fluid, and then they can see it's yeah, the swelling that it's, I don't know the word, palpation of carotid. I already palpate the carotid. Now I'm gonna palpate for the radial pulse. Carotid pulse, one at a time. So now I'm gonna for the pedal pulse. Good pedal pulse. He has good circulation. So now I'm gonna listen abdomen. Okay, go lay down. Wait. Okay. Yeah, come on. Yeah, mash For the abdomen, I'm gonna start with the inspection again. First, I'm gonna inspect his abdomen if there's any. I can see his abdomen is flat, so he doesn't have any scar, anything noted. So now I'm gonna listen for his bounce sound. I'm gonna start from the right lower quadrant, and then right upper quadrant, left upper quadrant, and left lower quadrant. Okay, he has normal bounce sound. So now I'm gonna do percussion, so it should be tympanic, and do it over the lever. Okay, now I'm gonna do light palpation. Do you feel any pain when I'm okay?
No.
No pain?
No.
Okay, good. So now I'm gonna do deep palpation. When I'm doing deep palpation, I'm gonna check for appendicitis at the same time. So I'm gonna press, and then when I take my hand out, you let me know if you feel any pain. Do you feel pain?
No.
No. So I'm gonna list. This is where the liver is gonna right upper quadrant. So I'm gonna check if there has any gallbladder inflammation. So I'm gonna press, and I'm gonna ask him to take a deep breath. Good. So you feel pain?
No.
Okay, no pain. So I'm gonna palpate to the right left upper quadrant, so I should not palpate the spleen. That's why it is. So okay, it's negative for Murphy sign when you check over the gallbladder. So he's negative for Murphy sign. So now shift in dullness. So I'm gonna check for fluid. So I'm gonna move both. So there's no fluid. You can see there's no shift over. He doesn't have no ascites. The palpation, assess for kidney. Okay, now Johnny, you can sit down. So you're negative for Murphy sign. So I'm gonna check for kidney for tenderness of the kidney. It should be between the 12, like between the 12 ribs. So I'm gonna do you feel pain?
No.
Okay. All right. No. Okay. No kidney tenderness. So now I'm gonna check his upper extremity for strength, range of motion, and I'm gonna, so you can see from inspection he doesn't have any, is symmetrical. So now I want you to rotate your shoulder, rotation, and then supination of your hand and pronation of your hand. Okay, now good. So now I'm gonna try to bring your hand down. Don't let me do it. Okay, strength. And I'm gonna try to bring your hand. Okay, good. He has, now I'm gonna check. Now, don't let me push you. Okay, good. So now put your hand up. Okay, now down. All right, he has full range of motion in his upper extremity. So he's able to do rotation. He's able to do supination and pronation. So now I'm gonna check his lower extremity for joint. So I want you to stand up. I want you to squat down. All right, you can see he is able to do that. So now I want you to walk. So he's able to walk. And I want you to come back again. So now I'm gonna check. I want you to bend down and touch your toes to check for scoliosis. So you can see his spine, he's in a straight line. Now you can stand up. So now I'm gonna test for the wombat test. I want you to put your feet together, checking for your balance, and then close your eyes and your hand on the side. So are you okay? Okay, good. So you can sit down now. Now I'm gonna do so I can say that he has full range of motion in his upper and lower extremity, and then he has full strength in upper and lower extremity. Now I'm gonna I already checked for the pedal pulse, extremity, upper extremity. For scoliosis, no scoliosis noted. Okay, now I'm gonna test for the he has motor function. He has good motor function. He's able to walk back and forth. And then, oh Johnny, can you stand on your feet and then for your band and put one of your feet up? Okay, good. The other one. Okay, good. So now I'm gonna check for coordination. I want you to touch both. Okay, good. So I touch your nose and then follow my finger. Okay, good. Okay, do the other hand.
Start view, no?
Okay, good. So now I'm gonna check for sensation in his lower and upper extremity. Right, looking, this is gonna be a sharp and this is gonna be dull. So you let me know when you feel it. I want you to close your eyes. What sign?
Sharp.
Okay. What is this one?
Dull.
Okay. What is this?
Sharp.
What is this?
Dull.
Okay. What is this?
Dull.
What is this?
Dull. Dull. Sharp. 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 Dull.
Okay,
Dull.
good. So he has good sensation in both upper and lower extremity. Now I'm gonna check your cranial nerve 7. I'm gonna try to close your eyes and then don't let me do it. Okay, good. And then now I want you to smile. Okay, good. He's able, and I want you to put your eyebrow up. Okay, good. He's able to, cranial nerve 7 is intact on his facial. I thank you so much. I think I cover everything. Information, supination. Alright. Alright. So I think I do my best to cover the physical assessment in 20 minutes. It's a little bit kind of hard. This is my 6th time doing it. And I think I covered everything. All right, Junior, you can stop it.